Paul Lyons. I'm from the University of Cambridge. Our lab has a long-standing interest in understanding how you might use integrative genomics to improve patient outcomes across a range of immune-mediated disease. And by immune-mediated, I mean both autoimmune, like for example systemic lupus erythematosus, but also auto-inflammatory, like the inflammatory bowel diseases, Crohn's disease and ulcerative colitis. About a decade ago, we identified a cell subset specific transcriptional signature that predicts outcome in patients with Crohn's disease. And this has been turned into a biomarker. And as part of the SYSCID program, we're interested in seeing if we can use cell-specific DNA methylation to extend the use of that biomarker in clinical practice. So our role in the SYSCID project is to extend an observation we made almost a decade ago in patients with a range of immune-mediated diseases where we could predict long-term outcome using CD8 T-cell transcriptional signatures. Now, one of the issues with the use of these CD8 T-cell signatures at diagnosis is that it requires active disease. So as part of SYSCID, what we're trying to do is see whether we can use DNA methylation signatures to do the same thing. Well, I think this is actually quite critical for the kind of systems medicine approaches we're interested in doing. If you use whole blood, what you tend to find you see when you're doing your measurements is you're measuring differences in cell numbers between different immune cell populations. And we know that across many immune-mediated diseases, cell numbers change, driven by the disease process. If you really want to understand what's happening at a molecular level in these diseases, you need to actually separate out the individual cells, and you can either do that in the context of bulk analyses of individual cell populations, which is what we do, or you could use single cell sequencing or transcriptomics. And by doing that, we should understand at a cellular level the molecular pathways that are important in disease, which should allow us to identify novel therapeutic targets and improve patient outcomes across a range of diseases. The major advantage I've just alluded to is that you actually dissect out the underlying molecular pathways that are important in disease. And by doing that, and by annotating those pathways, we understand at a molecular level what's different in patients compared to controls or healthy individuals. And by doing that, we should be able to identify novel therapeutic targets that can be approached in a druggable way. And by understanding and treating the underlying molecular pathways that drive disease, rather than simply the box that is your disease diagnosis, that should really improve the efficacy of how these treatments work. Good. Well, I think Philip Rosenstiel is to be congratulated on assembling an absolutely stellar cast of European scientists, all of whom have overlapping but really complementary approaches to understanding disease. So we've made significant advances in our understanding of how DNA methylation underlies CD8 T-cell transcription and how that might be used to build new prognostic biomarkers. But I think more broadly, what I've got out of the whole SYSCID consortium is the development of new interactions with many different researchers who I hadn't previously met, all of whom have their own individual take on how we should go about dissecting complex disease. And the answer is we've been quite badly affected in that we've not been able to carry on researching much in the context of immune-mediated disease, but all of the techniques that we use for the study of immune-mediated disease we've been able to apply to the analysis of COVID-19. So as part of the first wave back in March 2020, our team recruited patients with a range of COVID severities that were being seen in Addenbrooke's and Papworth hospitals in Cambridge. We isolated white blood cells from these patients, we did detailed immune phenotyping, and we did transcriptomics. So all of the stuff we would apply to immune-mediated disease, we applied to these patients with COVID. And that allowed us to make a number of important observations. It allowed us to determine some of the immunological features that prevent patients going into hospital, so why some patients get asymptomatic or mild disease. And then amongst the patients that end up in hospital, it allowed us to dissect out factors that contributed to why some patients ended up in intensive care on ventilators, whilst others were sufficiently treated by just oxygen supplementation. What have I got most out of the SYSCID consortium, I think, is meeting other like-minded scientists who are all interested in understanding immune-mediated disease, but all come at it from different angles. Some, for example, people are using an analysis of the microbiome, others are using single-cell omics techniques, and understanding how these technologies that we're not very familiar with in our lab could be applied in the context of work we do has been very fruitful and very forthcoming. Over the last couple of decades, we've made significant advances in understanding some of the underlying molecular biology of disease. What hasn't happened yet is the translation of this knowledge into improved patient treatment and improved patient outcomes. And I really think the next steps have to be translating the advances we've made at a molecular level into clinical practice.